What is bladder wall inflammation in interstitial cystitis? Imagine a bladder that feels sore, tender, and irritated without any infection or bacteria involved. That's what happens in bladder wall inflammation caused by interstitial cystitis. This condition, also called bladder pain syndrome, is a long-term issue where the lining and tissues of the bladder become inflamed and sensitive. The inflammation makes the bladder wall stiff, scarred, or less elastic, which means it cannot stretch properly when it fills with urine. Sometimes, tiny bleeding spots or sores known as ulcers can develop on the bladder lining. People with this inflammation often experience persistent pain in the pelvic area, a feeling of pressure, and a frequent urge to urinate. Some may need to go as often as 60 times a day, especially when the bladder is full. The discomfort usually gets worse as the bladder fills and eases after urination. Pain during sexual activity is also common. The root cause of this inflammation is not fully understood, but it is believed to be linked to a defect in the bladder's protective lining. Normally, this lining keeps urine from irritating the bladder wall. When it becomes leaky or damaged, urine can seep through and cause irritation, leading to inflammation. Other factors that might contribute include immune system activity, allergic reactions, or autoimmune responses, but no single cause has been confirmed. It is important to note that bladder wall inflammation in interstitial cystitis is not caused by bacteria or viruses, so antibiotics do not help. Unlike urinary tract infections, which often improve with antibiotics, this inflammation persists without infection. This condition is more common in women, especially those between 20 and 50 years old. While it can significantly affect daily life due to pain and frequent urination, there is currently no cure. Treatment focuses on managing symptoms and protecting bladder health. It is essential to distinguish this inflammation from bladder cancer, which involves abnormal cell growth. Unlike inflammation from interstitial cystitis, bladder cancer involves changes in the cellular structure of the bladder lining and can be more serious. In summary, bladder wall inflammation in interstitial cystitis is a chronic, non-infectious irritation of the bladder lining that causes pain, urgency, and frequent urination. It results from a compromised protective layer and immune-related factors, and it requires careful diagnosis and ongoing management. If you experience symptoms like these, consulting a healthcare professional is crucial to rule out other conditions and find the most appropriate treatment plan to support your bladder health.